Meanwhile, you've got this potential life-saving breakthrough in the fight against breast cancer. The FDA authorizing an AI tool, artificial intelligence tool, aimed at predicting a woman's risk for the disease over the next 5 years by the use of a mammogram. Dr. Mark Siegel, Fox News senior medical analyst, and Doc, good morning to you. A couple things here I want to set you up. Sam Altman of OpenAI says that the medical advances in artificial intelligence are coming very quickly, faster than I think a lot of people thought. Here is the woman who works with Clarity. That's the name of the company with this new test. For more than 60 years, mammograms have saved lives by detecting early-stage cancer. Now, advancements in AI and computer vision can uncover hidden clues in the mammograms, invisible to the human eye, to help predict future risk. I find this profound. As a doctor, what do you think about it?
I think it's profound for a lot of reasons. A study out of radiology a couple years ago showed that using artificial intelligence with this exact product improves sensitivity, meaning the eye of a breast radiologist looking at a mammogram. Just talking about a mammogram now. Sometimes we see things, or they will see things that aren't clear. We have to follow it over time. You don't know what to tell the patient exactly. AI improves how focused in on it is and how predictive it is, very dramatically in studies. And Nicole Saphier, our own breast radiologist here, who's at Sloan Kettering, one of the top in the country, has come out on supporting this. Others have as well, because it's not something to replace radiologists. It's a tool she and others can use going in to say, hey, here's something with the mammogram, but here's something AI is predicting. What does AI say? What does the mammogram say? And Bill, bottom line, in areas where you don't have a Nicole Saphier, like in rural areas or underserved areas where you're relying on radiologists without special training, this is even more important. This is the wave of the future. AI is going to be part of the equation, but it's not going to take over.
All right, breast cancer now. Let me show the numbers quickly. Per year now, 2.3 new cases worldwide. In the U.S. alone, 370,000 per year new cases. All right, that's topic one. Here is now topic two. Reports suggest that the health risk from cannabis will grow as a user ages, all right? From the New York Times report, studies in the U.S. and Canada, which legalized non-medical cannabis nationally in 2018, show climbing rates of older people seeking medical treatment for cannabis-related issues, both in outpatient settings and in hospitals. What are they learning here, doctor, that we all need to understand?
This is also very disturbing because 7%, they're learning that 7% of people over the age of 65 are using some kind of cannabis product regularly, and they may not be keeping track of how much THC they're getting. You might use a gummy to go to bed, and then the next thing you're using 2 gummies or 3 gummies, and it could increase anxiety, it can increase discombobulation, you're not thinking clearly. ER visits are on the increase. 4 times as many problems leading to ER visits with cannabis-related products in the elderly. I reported yesterday about problems with the heart with too much THC. We know about problems with the lung. Again, there's problems with the brain. It can accelerate dementia and can affect behavior. This is not something that people think wrongly. It's just as bad for you, or they don't know that it's as bad for you as cigarettes. It actually is in terms of its damage to the heart and lungs. It is absolutely an active chemical we need to watch out for, and I'm very disturbed that elderly are using it. I'm disturbed that pregnant women are using it.
Okay, so 39 states have permitted it for medical use. We can show people the map on that. Just about everywhere now across the country, all right? 24 of those states have made it legal for recreational use. But I think the point of this is that as users age, do you think that we jumped the gun on this legalization too soon? What's your view on that?
I think the two things are connected, because I think even in those states where it's only medically used, you wouldn't believe how easy it is to get it. You just show some certificate. You know, in California, before it was recreationally approved, it was medically approved, and it was a joke. Everybody could still get it. What is the medical use of marijuana? We haven't even defined that yet, and it's easy to get in those 39 states. We've completely jumped the gun here because people are going to the ER with psychosis. They're going there with vomiting disorders. They're having car accidents in a result. We are studying Colorado ever since it was legalized there, and the results are not pretty. We definitely jumped the gun by not anticipating all the medical risks here.
Okay. Doctor, good to see you. Mark Siegel, thanks for coming on today. Two very important topics.
Good to see you, Bill.
Thank you.
I'm Steve Doocy.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.